Deep oscillation with the Hivamat 200 is an entirely new therapeutic procedure. Deep oscillation is intended to supplement and intensify techniques of manual therapy rather than replace existing forms of therapy. For treatment, both therapist and patient are connected to the unit. The therapist by an adhesive pad stuck on a piece of plastic foil and attached to the arm under an armband. The patient by the neutral bar. The therapist wears special vinyl gloves which serve as an insulating layer. The optimum therapeutic effect is established on dry skin surface only. In order to enable an efficient therapy, powder is applied to the area undergoing treatment. The therapeutic effect of deep oscillation is based on the electrostatic field, which is set up between the therapist's hands and the patient's tissue. The electrostatic field is pulsed biphasically. This causes the corresponding tissue to be attracted and again dropped in the rhythm of the frequency selected when the therapist's hands move. This results in a penetrating and enduring resonant vibration of the tissue segment treated. Resonant vibration causes a pumping effect on the tissue segment undergoing treatment. In disturbed conditions, the treatment very quickly causes improvement in the removal of wastes and uptake of nutrients, as well as lymph flow activation. The subsequently intensified hematoma disintegration, suppression of inflammation and reduction in tissue pressure results in enormous pain relief and muscular detonization. Parameter selection depends on the individual tissue conditions and the treatment technique applied. The vibration is adapted to the consistency of the tissue by varying the mode function, frequency, dose, treatment pressure and velocity. Frequency equals the speed of the tissue deformation. Low frequencies provide a powerful pumping action with fluid displacement and are therefore suitable in the treatment of edema and pulmonary diseases. Medium frequencies have an intense detonizing effect and lead to a circulatory improvement in the tissue. Higher frequencies are very well suited to dissolve indurations and for pain relief. The mode function alters the resonant vibration, which can be adjusted from slight to intense. This happens by varying the ratio of pulse time and interval time. Therapy time depends on the state of the tissue and its change during treatment, as well as on the size of the area undergoing treatment. Normally, acute tissue conditions require shorter treatments of 10 to 20 minutes. Chronic states, however, call for longer therapy of 20 to 30 minutes. Dosage during Hivamat 200 therapy is adjusted following the principle of minimal intensity. Most of the time, a low dosage is sufficient to provide an effective resonant vibration. Deep oscillation is applied as treatment for respiratory tract diseases with great success. The resonant vibration very quickly results in an effective detonization of the respiratory muscles, which may be observed by an increase in the tidal volume during treatment. Additionally, the resonant vibration contributes to loosening sputum. By varying frequency, the resonant vibration may be adapted to the individual patient's conditions. One of the main advantages advantages of deep oscillation by the Hivamat 200 is that of the analgesic and detonizing effect, occurring even with minimal mechanical action, that is, treatment pressure. This opens up the possibility of treating acute cases and patients with highly sensitive pain conditions, such as whiplash injuries. Due to deep oscillation, the recovery of the micro and macro trauma shortens decisively. In case of thermal tissue lesions, as this large-size burn, therapy with the Hivamat 200 offers similar advantages. For protection of the wound area, treatment is performed through a special surgical foil. The treatment accelerates the removal of burn toxins, provides a faster immunological activation and an enormous trophic improvement, and enhances granulation. At the same time, there are no cicatricial contractions. In sports injuries, such as this rupture of a ligament, the Hivamat 200 is also employed with great success. The deep penetrating resonant vibration improves the local circulation, which enhances the edema resorption, the reduction in tissue pressure, and the disintegration of indurations of the connective tissue. Deep oscillation by the Hivamat 200 allows faster mobilization and freedom from pain, with subsequent shortened period for recovery. The hand applicator can be used for self-treatment. This way, deep oscillation can be performed by the patient at home, supplementing treatment by the therapist or in aftercare.